Hi, Cornerstone Family. So good to see you. It's me, your doctor, Dr. Sabine Elisee, board certified family medicine physician, CEO, and co founder of Cornerstone Medical Group here in Coral Springs, Florida. So I'm so happy we have a chance to hop on today. I want you to go ahead and grab your pen, your paper, and just grab maybe your iPhone or whatever it is that you want to take notes in today, because today we are going to be speaking about high blood pressure. So I want to talk to you about high blood pressure today, particularly because it's the summertime. And the summertime, when it gets a little bit hotter, this is the time when we see that the blood pressure tends to go higher. So today we're going to review some of the main causes of high blood pressure. I want to talk to you about the symptoms, and I want to talk to you about the real danger of it. All right, are you ready to learn? Good, because I'm ready to teach. So here we go. High blood pressure, also known as hypertension, and some people just even call it pressure. So what that actually does, I always think about it like a balloon. Think about a balloon that you blow up, that you don't get a chance to ever stop blowing up. What's going to happen? You keep blowing up that balloon, it's going to pop. So that's essentially what occurs in high blood pressure. So let's talk about the causes first, and then we'll go back to that balloon illustration in a moment. So the causes, one of the most important causes, or the strongest link to high blood pressure, is related to your family history. This is called your first degree relatives. Now, this is any one of your family members that I call are above, below, or to the side. Not so much those distant cousins or those aunts and uncles that are twice removed, but above, below, and to the side. So who are your primary or first degree relatives? I'll tell you who they are. Above, your parents. Below, your children, and then to the side, your siblings. If any one of those individuals suffer from high blood pressure, are taking medication for high blood pressure, or have been told and diagnosed by a physician as having high blood pressure, well, that increases your risk of having high blood pressure too. So that is the family history, the family dynamic, and that has a very strong correlation to it. And sometimes it makes it a little bit harder to control, but don't worry, we're going to get your blood pressure control if that is something that you suffer from. So the second thing we want to talk about that causes high blood pressure to go on up very high, or to cause people to have and suffer from high blood pressure, is kind of what we're all facing right now. Increased levels of stress. We're all feeling it. We're in a pandemic. We don't know what's going on. It seems like it's a bad story that just keeps on getting worse. There's such uncertainty. But I want you to find a ways to channel that stress that you may be feeling. So maybe it's not from the pandemic. Maybe you're one of our Cornerstone Families participants who are an entrepreneur, or you're a grinder, or you're the person that holds everything together in your house. That is high stress. And if you are not finding a correct way to channel that stress, well, you become like a pressure cooker. And that pressure cooker is building up that stress. It's building up the pressure, thus high blood pressure. So what are some of the best ways that you could channel some of that energy or get rid of some of that stress? Well, this is why I encourage you to exercise, to get moving, to do the things that you enjoy doing. You also have to allow your brain to connect with your heart and recognize that this is a stressful time. This is something that's a difficult thing. You don't have to be strong all the time. I'm going to say it again. You don't have to be strong all the time. I want you to give yourself grace and recognizing that this is hard, whatever it may be, whatever situation that you're in right now that is causing that stress. I don't want it to be the cause for you to have blood pressure that is uncontrolled. So I want you to find a way, one, to recognize that stressor, to address that stressor, and to do number three, get moving. When you get moving and you just exercise, or you kind of step away from everything, that allows you to actually deal with that stressor. So those are our two big causes. There's lots more, but I want to give you the high yield and keep the video short for you because I know all of you are busy. So the two big causes, again, is a family history, and then number two, stressful situation. So let's now talk about the symptoms. What are the symptoms? Well, some people will have headaches. If you're having headaches every day, that could be a problem. Some people have blurred vision, not just this, your regular glasses aren't working too well, but you consistently are having this blurred vision. And one of the biggest things that we also see too is pain in the back of the neck. Pain in the back of the neck. If these are any of the things that you're suffering from on a regular basis, I want you to call me. You have my number. You know how to reach me directly. I want you to text me, whatever it is. If you're having those symptoms on a regular basis, it may be an indication that your blood pressure is getting too high. And just because you have a blood pressure reading that's high one time doesn't necessarily mean you have high blood pressure, but it's not until you come in and we see you at the office and we have that reading 3 times consecutively at being high, then we could say this is high blood pressure. If you're one of those individuals, like most of my patients, as great as you are, you're probably going to be on top of this. If you are going to go and get a blood pressure machine to check it for yourself at home, I want to encourage you not to get the one that just stays at the wrist. I want you to get the one that goes at the arm. But more than anything else, just give me a call, right? I encourage you to give me a call. So those are our symptoms: the headaches, the blurred vision, the pain in the neck. These are the things that I want to make sure that you are paying attention to so you will know if you are having high blood pressure. And now let's go back to the danger of high blood pressure. This is where we're talking about that balloon. High blood pressure and a balloon. So let's think about this. Our blood vessels are that balloon. Our blood vessels, they stretch. The blood pumps through. So now when you're blowing up a balloon, like I said, you're blowing it up slowly, slowly. You never stop blowing it up. What happens? It will pop. So if we liken that to what our example is about our blood vessels, when we are allowing our pressure to go higher and higher and we're not checking it, and sometimes you don't even feel it, and you're not really addressing it, when it goes higher and higher, that blood vessel will pop. And what do we call that? A stroke. That's a stroke. And that is the most dangerous thing about high blood pressure. I know this might sound cruel, but I am really serious when I say this. If you are lucky, high blood pressure will kill you. Yeah, I know. Dr. Elisee is being mean. But the reality is, if you're lucky, high blood pressure will kill you. Because what happens for most people? For most people, what occurs is that the pressure goes high and they have a stroke. And they're left at very young ages with the inability to use half of their body, the inability to recall, whatever it may be. And they end up having to go into assisted living facilities and live there. And now the rest of their life has completely changed. They understand and see what's going on, but they are now completely and totally dependent on other people taking care of them. And that's why this is the most dangerous thing about high blood pressure that remains high and continues to go uncontrolled. So I want to encourage you this month to make sure you are paying attention to any one of those things and don't hesitate to call me. For those of you who already are diagnosed with high blood pressure, I want you to continue to take your medications regularly. I want you to make sure you're checking that blood pressure maybe twice a week. Pay attention to any of the symptoms, and particularly here in the summertime. You know, in Florida, we go from hot, hotter, and hottest, so it always feels like summer. But particularly now, as we're at that hottest season, I want to encourage you to make sure you're staying on top of your water intake, because that water intake as well too helps control the blood pressure. Yes, if you are dehydrated, you're not getting enough water in, the pressure actually is rebounding and going a little bit higher. We're not too sure of the full science behind it, but that is something that we recognize that happens a lot, that if you have high blood pressure and you are not drinking the water as you should be, and in these summer months especially, then your pressure will go higher. So I'm so glad again that we had a chance to speak today. If you have any questions, be sure to email, call, text. You know how to reach me. I'm hoping and praying that all of you are doing so well and that your families are doing well. And we're going to get through this thing together. Remember, you have a health partner for the long term, and your health partner is me, Dr. Sabine Elisee. Love seeing you guys. It is a joy to take care of you, and have a wonderful, wonderful day.